Hey, Dr. Ronson from Mission Health Center. Today I want to talk about the two techniques that we predominantly use when it comes to treating your low back pain. As a little review, if you recall, your low back is down here in the bottom of your spine, and there's 5 spinal bones that make up what's called your lumbar spine. And in between each of those bones is this cushion that we referred to as a disc. Now, what's important about that is that when your spine is in proper alignment, whether it's straight from the front or has this nice curve on the side, that allows the spine to do what it's supposed to do. But when your spine shifts out of proper alignment, it will compress on a nerve and ultimately lead to you experiencing some level of back pain. So here's how we treat a patient in our office that is suffering with low back pain. Step number 1 is that we do what's called palpation. And all palpation means is that we're gonna feel the spine. We're gonna feel the muscles on the right side as well as the muscles on the left side. We're gonna see how well the patient's hips are moving and make sure that they're doing what they're supposed to do. We're gonna apply pressure to each of the spinal bones to see if there's any area that is tender or sensitive or is even painful. And then after we have located where we see or feel a shifting in the spine called a subluxation, we're going to use a spinal adjustment to ultimately serve as a corrective means to helping that area heal. Now, the two techniques that we'll use is, in our office, we'll use what's called a Thompson drop technique. And this is a very low force technique that ultimately uses a mechanical advantage to help the body ultimately change, and it makes it easy on the patient as well. So what you'll see here is the table will lift up, and all we'll do is we'll apply pressure right down on the spine there. We're trying to target that spinal subluxation or misalignment in there. And ultimately, this is one of the techniques we use in our office to help to realign the spine. Now, the second technique we use is something called the diversified or Gonstead way of adjusting the spine. And we use this in well over 50% of our patients' cases. And so if you would, Fiona, lay on your side and face me this way. So one of the things we do here is we're going to target this very small part of the lower back down here on this left side of Fiona's body. And all you'll see here is we're just going to kind of get the patient into the right position. And we're going to apply a little bit of a pressure right in this area. Deep breath in and all the way out. Good job. And that's it. Those are the two different techniques that we use in our practice to help to align or to remove the subluxations from the lower back. I'm Dr. Ronson from Mission Health Center.